So I'm going to show you how to perform a transverse friction. This is for sports massage level 4. Transverse friction is appropriate when you're trying to break down an adhesion within a muscle, so intramuscular adhesions, or whether there's been any scarring within the muscle from muscle damage, maybe a muscle strain. Before you do a transverse friction, you need to make sure it's appropriate, so you need to do your 10-second pressure test. With your 10-second pressure test, apply pressure up to a 6 or 7 out of 10. If the pain stays the same, then it's a transverse friction. If it goes down, then you move to your trigger point therapy. And if the pain goes up and it's a new injury, it's possibly still inflamed and it's not yet ready to receive a transverse friction. So remove your pressure and don't treat that area. So we're going to have a look in the hamstring and see if we can find any adhesions that we can work through. So just moving up the inside of the hamstring, which feels quite tight. And there's a nice spot here, semimembranosus and tendinosis. So, Pino, how does that feel? Is that a 6 out of 10? More or less?
Less.
A bit less. So I'm just going to find, feels like a nice tight spot. So just about there?
Yeah, that's 7.
Okay, good. So hold it for 10 seconds. And is that pain staying the same?
Same actually.
Staying the same. Lovely, good, okay. So now we can move directly into a transverse friction. Don't release the pressure, keep consistent contact, and the hamstrings move from the back of the knee, let's say, to the lower leg, all the way up to the hip. So our transverse direction would be to move across the back of the thigh in the horizontal plane, and we're going to do 3 to 5 seconds of movement across that muscle fibre and then release. Well, I might do 3 transverse frictions, so come back in, make sure the pressure's okay, is that all right?
Yes, 7 I would say.
7, and make sure that your client consents each time to a transverse friction, and just make them aware of what you're doing as you do it. Good, 1 more transverse friction, ready? In, good, 7, you're right, and then a little transverse friction, 3 seconds, and then release. Transverse frictions can be quite painful. They can cause bruising in an area, so you need to make sure that you get feedback from your client all the time and that you get consent to do that, that technique. There you go.